nursing examination for a PBBSc nursing students. PBBSc in the sense post basic BSc nursing, and post BSc basic nursing students have an annual examination in the month of July 2nd. And very importantly, here I am referring some questions. Questions are chosen from question papers of different years. Here, some of the answers given is not up to the point. So, what we have to do is prepare ourselves for the answer. We need just a question. See, here is a question: collective bargaining. What does it mean? It came in the year 2015, March. Collective bargaining is the negotiation activity between the employee and the employer for a better working to determine better working condition, wage, or any other like working hours, etc. So, how to do this collective bargaining? First, it must be planned and call a meeting with the employer. Once it is done, that bargaining activity takes place. ಇನ್ನೊಂದು ಯಾವ್ದಾರು ಓದ್ ಮಾರೆ ಅಡ್ಡಿಲ್ಲ, ಇನ್ನೊಂದು ಯಾವ್ದಾರು ಓದಿ ನಾವು ಓದಣ್ಣ ಓದು ಯಾವ ಜಿ ಬೇಕಾದ್ರೆ ಓದು. ಆಯಿತಾ? Define in-service education. In-service education is the education.
A very long time ago, when I was still young animals old.
Socialized. Define in-service education. In-service education is the training program or education program given to employees to make them more competent and to get knowledge about the trends related to their profession and making them more efficient in their work, etc., etc., etc.
Papa,
Yes.
one thing will in 1 month, only one time full moon will come.
One time?
Full moon will come.
I don't know, maybe. So this is the question paper, question bank actually. Define performance appraisal, promotion, define in-service education, collective bargaining, zero budgets, and malpractice, and job ranking, planning, and if I go to next question. List the factors affecting quality nursing care. List the disciplinary problems among the staff. Write the meaning of spirit de corps. Define nursing audit services. Explain the meaning of control. The components of staff development program. So some different explain the techniques of inventory control, discuss the role of nurse manager in managing disciplinary problems in a nursing unit, describe the factors affecting the quality of patient care, explain role of a nurse in maintaining quality nursing care, student welfare services in School of Nursing, evaluation of in-service program in nursing,
You know,
define learning experiences, explain principles you will keep in mind while selecting learning experiences. What is narcoanalysis? So it is explained here. Neuroleptic malignant syndrome. It is a serious side effect of antipsychotic medications if it is given for a prolonged period or some overdosage or intoxication may lead to severe antipsychotic drugs side effect. Usually it is called EPS, extrapyramidal symptoms. And if you guess the neuroleptic malignant syndrome, then the patient must be treated very urgently because it is a fatal condition, and you must be aware the signs and symptoms of neuroleptic malignant syndrome, antipsychotic drugs and its side effect. What a beautiful subject is psychiatric nursing. Legal issues in mental health nursing. Every mental health nurse must know the legal issues related to a patient who is suffering from mental illness. If she or he knows those legal issues, then she can handle the patient very carefully. It will not trouble her or the patient anymore. Delirium disorder of the brain, organic brain disorder, progressive. So, in Alzheimer's disease, otherwise called, you can say Alzheimer's disease is also one type of a delirium. It's a progressive one. Patient will lose his memory, orientation, etc. List the signs and symptoms of attention deficit hyperactive disorder and explain nursing management for hyperactive child. Nursing management of somatoform disorder. Somatoform disorders are those where patients actually having no physical reason but they show signs and symptoms of particular diseases. It is because of a stress or some uh, mental ailment. Define mental illness. Explain in detail about the etiological factors of mental disorders. Explain the ICD classification of mental disorders. ICD in the sense International Classification of Diseases. It has divided. Okay. Next, if you come to community health nursing, you will see role of nurse in planning for health education program. Then write in short centrally sponsored health schemes and role of a village health guide. And if you come for a subject called sociology, you will get few more questions. Give the meaning of child abuse, dowry, accommodation, and social control, race, tribe, elements of community, then exogamy, mobility, isolation, Explain the problems of child labor in India, problems of working women, distinguish between society and community, and define culture, explain the characteristics of a culture. There are many more questions. It's really very dry subject it is. Dry subject it is. Describe the importance and application of sociology in nursing profession. So the most important question I think, because it is repeated in 2021, 2019, 2018, 2015, 2014, 13, 12, 11, 11 and 10, 2009. So this is the question bank of second year PBBSc nursing examination. Okay, and my best wishes to those who write the exam. Prepare well, do well.